You wake up and your mouth feels like dry sandpaper, your lips are cracked, your tongue is sticking to the roof of your mouth. The first thing you reach for is that glass of water on the nightstand, the one you put there specifically because this happens every single morning. Maybe you mentioned it to your doctor once. Maybe they shrugged and said it was just part of getting older. Maybe you stopped mentioning it at all and simply accepted it as one of those things that comes with age. But here's what I need you to understand right now. Waking up with a dry mouth every single day is not a minor inconvenience. It is not a normal part of aging. It is your body sending you a very specific biological signal about something that is happening during those 8 hours you are asleep. And in adults over 60, that signal is almost always pointing directly at one of 5 distinct underlying causes, at least one of which could be seriously affecting your overall health right now without you knowing it. A 2022 study published in the journal Gerodontology found that chronic dry mouth affects up to 46% of adults over the age of 70. But what almost no one is talking about is the finding that came right after that number. In the vast majority of cases, the dry mouth was a symptom of something else entirely, something specific, something that in many cases can be directly addressed. In the next 14 minutes, I am going to walk you through each of those 5 causes, explain exactly what is happening inside your body, and give you a concrete action plan you can begin tonight. I have spent years working with older adults on exactly these kinds of overlooked health signals, the ones that get dismissed as aging but are actually the body doing its job trying to get your attention. This is one of those signals, and you deserve a real answer. Before we go any further, I want to ask you something specific. Drop a comment right now with just one number. How many prescription medications are you currently taking every single day? Just a number, nothing else. I want to see that number because what I am about to share applies very differently depending on whether that answer is 1, 3, or 6 or more. And if you wake up with dry mouth every morning and you also feel exhausted despite sleeping a full night, add the word tired to your comment. That combination is something I need to see, and you will understand exactly why in about 3 minutes. Here's what is happening in doctors' offices across the country right now. A 72-year-old woman comes in for a routine checkup. She mentions, almost as an afterthought, that she has been waking up with a terribly dry mouth for the past 2 years. The doctor glances up from the computer screen, types something, and says, "That is pretty common at your age. Try staying better hydrated." She goes home with no answers, no tests ordered, and a quiet sense that her concern was not worth taking seriously. But here's what that doctor did not ask. What medications are you taking? Are you snoring at night? When did you last have your blood sugar checked? Has anyone ever told you that you stop breathing briefly during sleep? Those questions matter because the dry mouth is almost never the problem. It is the indicator of the problem, and when you silence the indicator without finding the source, the actual condition continues progressing underneath. In some cases, for years, the research that should have changed how we approach this symptom in seniors was already published. Most patients have simply never been told what it found. And that gap between what the evidence shows and what gets communicated in a 15-minute appointment is costing people their health in ways that are genuinely preventable. Now, if you are someone who wants to understand the why, not just what to do, but why the body behaves this way, then what I am about to explain will give you a completely different way of looking at this. Saliva is one of those things we take completely for granted until it is gone. Your body produces between 1 and 1.5 liters of saliva every single day. It protects your teeth from decay. It neutralizes the acid that bacteria produce. It helps you swallow safely. It fights microorganisms in your mouth. It even begins the digestive process before food ever reaches your stomach. When saliva production drops significantly during sleep, that is not a minor inconvenience. That is a system under stress. Now, here's where aging changes the picture in ways most people have never been told. First, salivary gland function declines with age. The acinar cells, the cells inside your salivary glands responsible for producing saliva, shrink in both number and efficiency over decades. Think of a water treatment plant that was built to run 12 pumps, but is now running 8. The output is lower, even when everything else in the system is operating normally. Second, the thirst mechanism weakens significantly after 65. Research from the European Journal of Nutrition confirmed that older adults are chronically underhydrated compared to younger adults. And the critical detail is this: with no sensation of thirst whatsoever, your body can be running at a meaningful fluid deficit and simply never send you the warning signal it once did. You are not ignoring thirst. There is no thirst to notice. The alarm system has gone quiet. Third, medication sensitivity increases with age. Your kidneys and liver clear drugs more slowly at 70 than they did at 45. A dose that was appropriate a decade ago can have a stronger and more prolonged effect now. Medications that list dry mouth as a possible side effect become more likely to produce that side effect, and at lower doses than younger adults experience. These are not small differences. These are fundamental physiological shifts that demand a completely different level of attention. attention. And yet, morning dry mouth continues to be dismissed as simply getting older, when the biology tells a far more specific story. The fifth cause, and the one that surprises almost everyone when I explain it, is medication. Picture this. You have been taking a blood pressure medication for 3 years, a sleep aid a couple of nights a week, an antihistamine during allergy season, and a bladder control medication your doctor prescribed 6 months ago. Each one has helped with its intended purpose. You take them exactly as directed, and you have never once connected them to the sandpaper sensation in your mouth every single morning. This is completely normal. Millions of people are in exactly this situation. And here's what almost none of them have ever been told. Over 400 prescription and over-the-counter medications list dry mouth as a known side effect. 400. We're talking about drugs that millions of seniors take every single day. Antihistamines for allergies, diuretics for blood pressure, antidepressants, bladder control medications, certain heart medications, and common sleep aids. Each one alone might produce a mild reduction in overnight saliva production. Combined, the effect compounds in ways that are rarely discussed at the prescribing appointment. The mechanism here is called anticholinergic activity. Let me explain what that means in plain language. Many of these medications work in part by blocking a chemical messenger called acetylcholine. Think of acetylcholine as the electrical signal that tells your salivary glands to keep working overnight. When that signal gets blocked even partially, the glands slow down, the mouth dries out, and when 3 or 4 medications are all suppressing that signal simultaneously, the effect is not additive. It multiplies. In a 2020 review published in the Journal of the American Geriatric Society, researchers analyzed data from more than 12,000 adults over 65. They found that seniors taking 3 or more medications simultaneously had a 63% higher likelihood of experiencing chronic dry mouth compared to those on fewer drugs. Not a marginal increase. 63% considered Dorothy. She was 71, a retired bookkeeper with 2 grown children, and she had been waking up with severe dry mouth for almost 2 years. She had tried every oral spray, every hydration trick, every suggestion her dentist offered. Nothing worked for more than an hour. When we reviewed her complete medication list together, not just the prescriptions, but the over-the-counter items she took regularly, we found 4 separate medications with documented anticholinergic activity. No single one was the obvious problem. Together, they had been shutting down her overnight saliva production completely. We worked with her prescribing physicians to adjust the timing of 2 of those medications to earlier in the day. Within 3 weeks, her morning dry mouth had reduced by roughly 70% without changing a single dose. Be completely honest with yourself right now. Do you know whether any of your current medications list dry mouth as a side effect? Comment the number of prescriptions you take daily below, because that number tells you exactly how important the next conversation with your doctor or pharmacist actually is. The fix. Write down every prescription, every supplement, and every over-the-counter medication you take, including anything you use only occasionally. Bring that list to your next doctor or pharmacist appointment. Ask the specific question. Could any combination of these medications be causing or worsening overnight dry mouth? Ask whether any drug could be adjusted in timing, reduced in dose, or substituted for an alternative with less anticholinergic activity. This single conversation has resolved morning dry mouth for many patients without changing their treatment plan at all. 0 additional risk, 0 additional cost. Now, the fourth cause, and this one involves something happening during your sleep that 40% of seniors have absolutely no idea is occurring. The fourth cause is something that affects an estimated 39 million Americans. Research consistently shows that the majority of them have no idea they have it. We are talking about obstructive sleep apnea. You go to bed, you fall asleep. At some point during the night, possibly dozens of times, your airway partially or fully collapses. Your body responds by forcing you to breathe through your mouth instead of your nose. Nasal breathing naturally maintains moisture throughout the mouth and throat. Mouth breathing evaporates saliva rapidly. And so you wake up with that intense, uncomfortable dryness that greets you every morning. But here's why this is far more serious than a hydration issue. When sleep apnea occurs, it is not just air being disrupted, it is oxygen. Repeated throughout the night, those brief collapses starve the brain and cardiovascular system of adequate oxygen during the hours when the body is supposed to be repairing itself. The physiological consequences of that repeated oxygen deprivation extend well beyond how dry your mouth feels when you open your eyes. Research published in the Journal of Clinical Sleep Medicine found that untreated sleep apnea in adults over 60 increases the risk of stroke by 60%. and the risk of significant heart disease by 40%. These are not small figures attached to a rare condition. These are outcomes connected to something that 40 million Americans are currently experiencing without diagnosis. Think about Margaret. She was 68, a retired school teacher who had been managing morning dry mouth for nearly 3 years. She had tried every product at the pharmacy. She limited caffeine. She kept water by the bed. Her dentist had noticed increasing tooth decay that seemed to appear without explanation. When she finally came in for a thorough evaluation, we started asking different questions. Her husband had been noticing something for years, but neither of them had ever connected it to anything medical. She was stopping breathing briefly during sleep, not occasionally. Regularly, Margaret was diagnosed with moderate obstructive sleep apnea. After beginning CPAP therapy with the humidifier attachment, her morning dry mouth resolved almost completely within 6 weeks. Her blood pressure, which had been quietly creeping upward for 2 years, also improved measurably within 3 months. Be completely honest with yourself right now. Do you snore loudly? Has a partner or family member ever mentioned that you seem to stop breathing briefly during the night? Do you wake up exhausted after what should have been a full night of rest? Comment sleep below if any of those apply, because those symptoms, together with morning dry mouth, are not separate annoyances. They are pieces of the same picture, the fix. For the next 7 nights, keep a small notepad by your bed. Each morning, note whether your mouth was open or closed when you woke up and whether you feel genuinely rested. Ask a bed partner, if possible, to listen for snoring or pauses in your breathing during the night. If a pattern forms, ask your primary care doctor for a sleep study referral. Most insurance plans cover sleep studies for patients over 60, and the test is now done comfortably at home. The CPAP equipment used today is quieter, smaller, and far more comfortable than anything available even 5 years ago. This is a solvable problem, but only if it gets identified. Now, the third cause, and this one is particularly important because in the United States right now, approximately 1 in 3 people who have it do not know it. The third cause is diabetes, both diagnosed and undiagnosed. Here's the mechanism. When blood sugar is elevated, the kidneys respond by pulling fluid from tissues throughout the body in an attempt to dilute and flush out that excess glucose. This creates a state of systemic dehydration that spreads through every tissue, including the salivary glands. Production drops, the mouth dries, and it tends to be most noticeable in the morning, after 8 hours of elevated glucose pulling fluid away from those glands. Without interruption, think of it like a sponge sitting next to a heat source. The heat does not damage the sponge. It simply pulls the moisture out of it continuously, hour after hour, until there is very little left to give. A 2021 study from the National Institutes of Health found that 83% of people with poorly controlled type 2 diabetes reported frequent dry mouth as an ongoing symptom. But the figure that should make every senior reading this stop and think is this one. Approximately 1 in 3 adults with diabetes in the United States is currently undiagnosed. They have the condition. The condition is affecting their tissues, their blood vessels, and their nerves, and they do not know it yet. Consider Alan. He was 74, a retired electrician who had been dealing with dry mouth every morning for about 18 months. He had attributed it to aging and had started keeping a large water bottle at his bedside. He also mentioned, almost as a side note, that he had been getting up twice a night to use the bathroom and had felt unusually tired most afternoons. Those details together, dry mouth, frequent urination, afternoon fatigue, told a very specific story. His fasting blood sugar came back at 138. His HbA1c was 7.1. He had type 2 diabetes and had had it, based on the numbers, for likely more than a year. The dry mouth had been his body's most consistent and visible attempt to get his attention. Be completely honest with yourself right now. Alongside the dry mouth, do you experience frequent urination, unusual fatigue that seems to hit particularly in the afternoon, blurred vision, or cuts that seem to heal slower than they used to? Comment tested below if you realize you have not had a blood sugar check in the past year. That single test could catch something your dry mouth has been quietly signaling for months. The fix: schedule a fasting blood glucose test or an HbA1c test. The HbA1c gives your doctor a 3-month average of your blood sugar levels. It takes less than 5 minutes of your time. If you have not had one in the past 12 months, make that call this week. Early detection of elevated blood sugar is the difference between a dietary adjustment and a medication regimen. The window for the easier intervention closes quietly and without warning. Now, the second cause, and this one is almost invisible because it works by disabling the system that is supposed to warn you about it. The second cause is chronic dehydration, but it works very differently in seniors than in younger adults. And that difference is everything. Here is what most people assume. If I were dehydrated, I would feel thirsty. I would know. That logic holds reasonably well at 40. At 65, it no longer longer holds at all. Research from the European Journal of Nutrition confirms something that should fundamentally change how older adults think about water intake. Adults over 65 are chronically underhydrated compared to younger adults. And in the majority of cases, with no meaningful sensation of thirst, the internal signal that evolution built to prevent dehydration simply becomes less reliable after a certain age. The nerve receptors that detect fluid balance in the hypothalamus become less sensitive. The kidneys become less efficient at concentrating urine to conserve water. The result is a body that is losing more fluid than it takes in day after day with no alarm being triggered. Think of a fuel gauge that stops working accurately at low levels. The tank can drop well below safe levels before the needle begins to move. By the time you notice something is wrong, you are further down than you thought, and dry mouth is often the fuel gauge that is still working even when the thirst sensation is not. Consider Beverly. She was 70 years old, active and careful about her diet. She drank coffee in the morning, tea in the afternoon, and water when she remembered. She would have described herself as someone who stayed well hydrated. When we reviewed her actual daily fluid intake carefully, accounting for the diuretic effect of her 2 daily coffees and the mild dehydrating effect of her blood pressure medication, her net effective fluid intake was considerably below what her body required at her age and activity level. She had no sensation of thirst. She simply woke up every morning with a dry mouth that she had accepted as normal. Within 2 weeks of a structured hydration protocol, the morning dryness had reduced substantially. Be completely honest with yourself right now. On a typical day, how many glasses of plain water do you actually drink? Not coffee, not tea, not juice, just water. Comment that number below, because that number tells you whether the simplest explanation might also be the most accurate one. The fix: begin drinking approximately 16 ounces of water spread across the 2 hours before bed. Not all at once, but slowly. Increase your total daily water intake to at least 64 ounces, spread throughout the day. Set phone alarms if necessary, and stop waiting for thirst to tell you when to drink. That system is no longer reliable enough to be your guide. Drink on a schedule. Your morning mouth will tell you within days whether it is working. Now, the first cause on this list, and this one is different from everything we have discussed, because it is a condition that specifically targets the very glands responsible for producing saliva and tears, and it is missed in the majority of people who have it. The number one underdiagnosed cause of chronic morning dry mouth in older adults is Sjogren's syndrome. This is an autoimmune condition that means your immune system, the system designed to protect you, begins mistakenly attacking your own tissue. In Sjogren's, the primary targets are the exocrine glands, the glands responsible for producing saliva and tears. Here is what makes this condition so consistently missed. Its primary symptoms are dry mouth and dry eyes, both of which are commonly dismissed as normal aging. The average time from the onset of symptoms to diagnosis for Sjogren's syndrome is 6 to 10 years. Not months, years. During that time, the immune attack on the glands continues. The function of those glands continues to decline, and the downstream effects on teeth, on swallowing, on eye health, on the joints continue to accumulate. The mechanism is this: the immune system produces antibodies, molecules that target specific proteins. In Sjogren's, those antibodies target proteins found on the surface of salivary and lacrimal gland cells. Think of it as your own security system being given the wrong instructions, identifying your gland cells as foreign tissue, and sending in a destruction team. The glands do not fail from aging. They fail because they are under active immune attack. A 2023 review published in the Annals of Rheumatic Diseases found that Sjogren's syndrome affects approximately 3% of adults over 60, with 9 out of 10 diagnosed cases occurring in women. The average age of diagnosis falls in the late 50s and early 60s, precisely the population most likely to dismiss dry mouth as a simple consequence of getting older. Consider Patricia. She was 63, a retired librarian who had been managing dry mouth and what she described as a gritty, sandy feeling in her eyes for almost 4 years. She had tried artificial tears and oral rinses. She had been told by 2 different doctors in 2 separate appointments that both symptoms were consistent with her age. It was a rheumatologist she saw for unexplained joint pain in her hands who finally connected the 3 symptoms together. Blood tests confirmed antibodies consistent with Sjogren's syndrome. Once she began appropriate treatment, her symptoms became manageable for the first time in years. Be completely honest with yourself right now. Does your dry mouth compared with persistent dryness or grittiness in your eyes? Do you experience joint pain that has no clear explanation? Does your level of fatigue feel out of proportion to what you are actually doing each day. Comment aware below if any of those sound familiar, because that combination of symptoms is not a coincidence. It is a pattern worth naming. The fix. If you have chronic dry mouth alongside dry, gritty eyes, especially if you also have unexplained joint pain or disproportionate fatigue, ask your doctor specifically about Sjogren's syndrome by name. Request blood tests for anti-SSA and anti-SSB antibodies. These are standard tests that are not expensive and are not complicated. Many patients with Sjogren's wait years for a diagnosis simply because no one connected the symptoms. You now have the language to make that connection yourself. For immediate overnight relief while you investigate the root cause, look for a mouth rinse or oral gel containing xylitol. Products like Biotene, Dry Mouth Oral Rinse, or ACT Dry Mouth Rinse are available in any pharmacy. Use them right before bed each night. Xylitol provides mild antibacterial protection for your teeth while you sleep. Avoid any mouthwash containing alcohol, which significantly worsens overnight dryness. If you have been waking up with a dry mouth for months or years and have been told it is simply part of getting older, I want you to hear something clearly. It is not your fault that you accepted that answer. When a doctor dismisses a symptom, most people defer. That is how we are taught to interact with the medical system. That deference is understandable, but it is also sometimes the reason a real underlying condition goes unaddressed for far longer than it should. The human body is a remarkable communicator. It does not produce persistent symptoms without a reason, and the capacity for recovery, even after years of a misdiagnosis, is something that continues to surprise me after all my time in this field. Conditions that have been progressing quietly can be identified. Medication regimens that have been compounding a problem can be adjusted. Blood sugar that has been elevated without detection can be brought under control. Sleep that has been repeatedly interrupted by apnea can be restored. Autoimmune activity that has been attacking glands for years can be treated and managed. None of these are sentences. They are starting points. Here is what you now understand that most people, including many healthcare providers, have not fully considered. Morning dry mouth in seniors is not one problem. It is a symptom that can point to 5 distinct and separate underlying conditions, each with its own mechanism, each with its own implications for long-term health, and each with a real and accessible path forward. Medication burden accumulates in ways that are rarely tracked across prescribing physicians. Sleep apnea carries cardiovascular risks that extend far beyond how tired you feel. Undiagnosed blood sugar elevation may be progressing silently for years. Dehydration in older adults operates without the warning system that younger adults rely on. And Sjogren's syndrome targets the exact glands responsible for the symptom you have been experiencing and is missed for an average of 6 to 10 years. You are no longer a passive recipient of a shrug and a suggestion to drink more water. You are an informed person who can ask specific questions, notice specific patterns, and advocate for a real answer in an appointment that tends to move too quickly to find one on its own. That is not a small shift. That is a fundamental one. Let me give you specific steps you can take starting tonight. First, do the medication audit. Write down every prescription, medication, every supplement, and every over-the-counter product you use, including things you take only occasionally. Do this tonight before you go to bed while this is fresh. Second, start the sleep log. Keep a notepad on your nightstand for the next 7 nights. Each morning, note whether your mouth was open or closed when you woke up, and whether you feel genuinely rested. Ask a bed partner to listen for snoring or pauses in your breathing if that is possible. Third, check your water intake honestly. Count how many ounces of plain water, not coffee, not tea, you actually drink on a typical day. If that number is below 64 ounces, set phone alarms starting tomorrow to build the habit of drinking on a schedule rather than waiting for thirst. Fourth, schedule a blood sugar test this week. If you have not had a fasting glucose or HbA1c in the past 12 months, call your doctor's office tomorrow. This is a 5-minute test that could catch something your body has been quietly signaling for months. Fifth, for tonight, if your dry mouth is making sleep uncomfortable, pick up a xylitol-based oral rinse at any pharmacy, use it right before bed, avoid anything containing alcohol, and finally, have an informed conversation with your doctor. Not a routine checkup, a real specific conversation. Bring your medication list, bring your sleep log, ask directly, could any of my medications be contributing to dry mouth? Should we check my blood sugar? Is a sleep study worth considering given my symptoms? You deserve a doctor who treats that list of questions as exactly what it is, the work of a thinking adult who is paying attention to their own health. Drop a comment right now saying informed. If what you heard today gave you something something real, if it answered a question you have been carrying without a satisfying response, I want to see that word. It tells me this kind of thorough, honest content is reaching the people who need it. Now think of one person you know who wakes up every morning with a dry mouth and has been told it is just aging. A parent, a partner, a friend who has been dismissing it for years. Send them this video right now, not later. Right now, that one action might be more useful to them than any appointment they have had recently. Subscribe to this channel. My mission is straightforward: to give you the kind of evidence-grounded health information that most people only encounter after something has already gone wrong. You deserve to have it before that happens. In my next video, I am going to cover something that generates more questions than almost any other topic I've received from this community: the specific warning signs that a very common cholesterol medication is doing more harm than good in certain people over 60. The research on this is more complicated than most people realize, and it deserves an honest, thorough answer. You will not want to miss it. This video is for educational and informational purposes only. It is not intended as medical advice. Any symptoms affecting your health should be evaluated by a qualified healthcare provider based on your complete medical history and individual circumstances. Never adjust or discontinue any medication without first consulting your doctor. The information presented reflects current published research, but it is not a substitute for professional medical care.